This is a patient post CREATE protocol, topographic ablation, including epithelial compensation with immediate cross-linking right afterwards, like we've made videos about before. This is interesting because we're only 13 days out from this young man. He was, before we started, a -6 with 275. The best he could get to is 2150. The left eye with a large amount of astigmatism as well, with 375, he can get to 2030. And you can look at his actual cones beforehand. They're pretty big. They're not small. Now afterwards, it's quite different. Now his epithelium has not healed fully, but even with that, he's only a -75 with really no astigmatism. He's already 2040. The left eye with a +50 and no astigmatism is 2020, and the cones are massively reduced. And so they are completely different. If we want to look at this on a Pennicam, because we don't get as much effect from the epithelium on the Pennicam, we can see the huge cones before and after, and really a massive change to the decrease in cone size. So what's really important here is this gentleman is going to actually be getting better for weeks and months. But here we are, 13 days out, and he can't believe he's seeing 20/20 out of that left eye, and we're getting on the 20/40 line out of that right eye with epithelium that's nowhere near completely healed yet. And this is how much this can change the vision and therefore the life and career of somebody.